Hi everyone, this is Ginger, and this is Boots, and you're watching Gnostic Psych, the channel where I share with you the arcane and interesting related to psychology. If you like this video or any of my other videos, please click like and subscribe. And today I'm going to be talking about dissociative fugue, which is the very rare condition when a person may forget their past identity and may engage in travel without any memory of the events having occurred during the fugue state. Dissociative fugue, formerly known as psychogenic fugue, is common among persons diagnosed with dissociative identity disorder. Dissociative identity disorder, which is referred to as DID for short, had previously been referred to as multiple personality disorder in the last Diagnostic and Statistical Manual of Mental Disorders, the Volume 4 that came out in 1994. In 2013, it was changed to DID. But DID is when a person's consciousness and identity are fragmented due to having experienced severe psychological trauma, whether severe long-term abuse, catastrophes, wars and atrocities, which the mind then blocks out by dissociation from the experiences. Dissociative amnesia is a temporary inability to remember autobiographical information, which is often a result of, again, severe psychological stress or trauma. Dissociative fugue was originally a separate diagnosis from both DID and dissociative amnesia in the DSM-IV, but was changed to a subtype of both diagnoses in the DSM-V. The reason for this was that dissociative fugue only accompanies both DID and dissociative amnesia. Even then, dissociative fugue is more commonly found among DID than dissociative amnesia. Also, just to be clear, not everyone with dissociative amnesia or DID experiences dissociative fugue. A diagnosis of DID or dissociative amnesia with dissociative fugue, like other diagnoses, can be made only after ruling out a number of things. First, a neurobiological condition, a medical condition, a traumatic brain injury, or the effects of drugs or alcohol, because a lot of times those can be mistaken for DID symptoms. DID and DA must then be differentially diagnosed from other mental disorders like psychotic disorders, seizures, personality disorders, conversion disorders, and even faking the illness. What makes DID and dissociative identity disorder with fugue diagnoses even more difficult is that individuals with it may have accompanying disorders like schizophrenia, depression, bipolar, OCD, PTSD, and just as another note, not everybody with PTSD has DID or dissociative amnesia. It can accompany borderline personality disorder and substance use disorders. Fugue states typically start suddenly after experiencing a traumatic or severely stressful occurrence and can last anywhere from hours to months. While experiencing a fugue state, a person may be confused about or assume a different identity. Dissociative fugue is more common among adults in their 20s to 40s. There is no specific treatment for dissociative fugue since it's such a rare condition. However, making a person with a fugue state feel safe while being treated can allow for the therapeutic process to begin. Medications can be prescribed for accompanying disorders, and psychotherapy that teaches coping skills for stress and psychological pain are beneficial, in particular CBT and DBT, which is cognitive behavioral therapy and dialectical behavioral therapy. Hypnotherapy and family therapy are also useful for retrieving traumatic memories. However, care must be made not to re-traumatize the person by exposing them too intensely to the memories. Just to kind of give you a little idea what the fugue state looks like, I found an article about a 28-year-old Nigerian man who had actually been in a fugue state and actually was missing for 10 days. And the article was published in 2013. The patient was in his final years of med school in southeastern Nigeria. While studying in his room at night, he saw a human skeleton reading at the same table where he had been sitting. The patient felt the room begin spinning around, and nothing appeared to be real. He then slipped into a fugue state. The patient was brought to a clinic by his younger brother who lived 355 miles away. The patient showed up at his sibling's house 2 days after he'd gone missing and with no memory of anything during that time. The patient reported that the brother had been paying his college bills and threatened to cut him off financially due to him having to remain for extra semesters. This caused the patient severe economic and academic pressures as well as intense chronic stress. The patient reports having low moods and had been experiencing a decrease in his appetite and outside activities. He also lost weight and began to become reclusive. The patient reported having suicidal thoughts but with no plan, and the battery of tests that were administered showed that there was no neurological abnormalities, no seizures, no traumatic brain injuries. He denied using any drugs or alcohol. And then the patient was administered the Dissociative Experiences Scale, which is a psychological test that screens for dissociative disorders. And he ended up scoring 50% and was diagnosed with dissociative fugue-like symptoms with major depressive episode.